Hello, my name is Lewis Arthurton, and I'm the Policy and Communications Manager at Alzheimer's Disease International. And today I wanted to give a quick oral presentation on the importance of national dementia plans in light of the disproportionate and devastating impact the COVID-19 pandemic has had on people living with dementia and their carers. So older people, including those living with dementia, have been disproportionately impacted by the COVID-19 pandemic. And country-level mortality data in some countries is demonstrating a critical need and failure to protect those living with dementia. So in Canada, of all COVID-19 deaths in 2020, dementia or Alzheimer's was reported on 36% of death certificates. In Australia, dementia constituted 41% of all COVID-19 deaths, 25 to 33% in the UK, and 20% in regions of Italy. Now, many governments are still to publish their COVID-19 and dementia mortality figures, and perhaps more worryingly, many are not capturing these data at all. And so as the COVID-19 pandemic continues, we are still seeing the human rights and needs of those living with dementia being forgotten in many parts of Europe and indeed the world, demonstrating a clear absence of preparedness and contingency planning for this constituency of people. And to add to this, recent evidence has shown an association between COVID-19 and persistent cognitive defects, including the acceleration of Alzheimer's disease pathology and symptoms in some individuals. Now, only with robust national dementia plans can governments prepare their health and care systems to meet the needs of their population. And such plans must also contain strategies to prevent this disproportionate and devastating impact on people living with dementia and their carers from happening again. And so to that end, I just wanted to share with you the progress towards the WHO Global Action Plan on Dementia. And as you'll know, in 2017, the WHO launched their Global Action Plan with the aim of improving the lives of people living with dementia, their families, and the people who care for them, while decreasing the impact of dementia on communities and countries. Now, all 194 member states signed up to this plan, consisting of 7 action areas that are highlighted on the screen. And as in the implementation of national dementia plans across all 7 action areas was the primary objective of the Global Action Plan, ADI has tracked the progress towards the plan through its report From Plan to Impact since its launch. Now, this is a really poignant year, as we're now over halfway through the Global Action Plan on Dementia. And as you'll see from the map, there is still a long way to go. In red, you will see countries with integrated and standalone national dementia plans, although not all of them with funding. In grey are the current plans in development, and in light pink are the countries which do not have a plan at present. Now, there has been some progress which has been made over the past 4 years, but there are still many areas where there are no plans in existence, for example, Africa. And this is a constantly evolving landscape, and just this year we have seen a small number of additional plans being implemented, for example, in Iran. We've also heard that Armenia is now on a 6-month trajectory to launch their plan. So just how far are we away from the target of the Global Action Plan? Well, currently only 37 WHO member states have national dementia plans in existence. And as you'll see from the sentence at the bottom of the screen, the target for 2025 is 146 member states, which equates to around 75% of the total, to have a national dementia plan in place by 2025. And the graph on the screen now just shows how much work there still needs to be done if we are to achieve these targets. So you'll see from the years 2022 to 2025, we need 28 new plans every year if we are to reach the targets. And this is an enormous challenge. So to conclude, we really need to motivate, accelerate, and really collaborate towards the progress of these targets if we are to get anywhere near the targets of 2025. And just to reiterate, all 194 member states unanimously adopted this Global Action Plan, and therefore have committed to developing national dementia plans. Now, our role as an organisation, but also as a community, is to collaborate and work with governments to make sure they take up the responsibility and their commitments to the 2017 plan. Now, there's a link on the screen to read the report. Please feel free to do so. And if you have any questions at all, please feel free to reach out to myself or Chris Lynch via our emails below. And thank you for listening to my presentation.